Hello and welcome to this recorded employee benefits presentation for the employees of Carlton Oaks for the benefit year beginning June 1st, 2022. My name is Bill Hammond. I'm proud to be your insurance broker. My contact information is on the screen and I'd be happy to help. If you have any trouble with the enrollment portal, if you need help choosing a plan, if you need help finding a doctor, both myself and your senior account manager, Rhiannon Gibbs Lopez, are here to help. Our contact information is there should you need us now or throughout the year. I'll talk quick agenda here. We'll talk about open enrollment, the dates you need to know, the benefits, how they work, changes we should be considering, and then we'll do a walkthrough on how you would be enrolling. So let's talk about dates. So our open enrollment period goes from May 18th to May 27th. This is the time of year where you're eligible to enroll or disenroll or waive any of your dependents. You can change plans, you can add dental, remove dental, move from an HMO to a PPO, whatever it may be. Any changes that you make will go into effect June 1st, 2022. We're asking that everybody complete this process no later than May 27th, and you'll complete your applications online at the Ease Enrollment portal. For those of you that do not have an email address, you will be given paper forms to complete. The medical plans we have available, we have 5. We have 2 PPO plans and 3 HMO plans. So we'll talk about those real quick. Here's our 3 HMO plans. So notice we have a bronze plan, a silver plan, and a gold plan. All right, so the bronze plan, this is the company plan. This is the plan that your employer is paying the majority of the premium for. A bronze level plan is a really good plan for catastrophic needs. It's really good for anybody that doesn't need to go to the doctor, the hospital very often. You just want something that is going to be there for you should you have a major claim, or for someone who just wants a really, really, really low cost insurance plan. And I have to say, this particular bronze HMO plan is the best one on the market. And the reason why is right here in the middle of the screen. Most bronze plans make you pay a very large deductible before you get any benefits at all. But this particular bronze plan gives you doctor visit copays of $75 for a regular doctor visit, $125 for a specialist, deductible waived. Okay. If you need lab work, so that'd be blood, you need your blood drawn, some blood work or x-rays, $125 deductible waived. Imaging, so CAT scans, PET scans, MRIs, $400 deductible waived. If you need physical therapy, occupational therapy, they waive the deductible. They treat it like a specialist visit. There's even a chiropractic benefit deductible waived. Okay, all the way at the bottom, we have an urgent care visit for $125 deductible waived. So that is the really good parts of the plan. Some of the other parts that make it really so inexpensive and that you need to be aware of is this $7,900 deductible. All right, a deductible is generally speaking what an insurance company says you must pay 100% of this number before they start paying any benefits. Now, everywhere you see the words DED waived, that means deductible waived. It means you do not have to pay the deductible first. So you see for a lot of these plans, doctor visits, diagnostic lab and x-ray, rehabilitation, urgent care. These are the kind of things that they waive the deductible, meaning you do not need to spend $7,900 before you get a $75 doctor visit. Okay. You'll notice with the silver plan, this number is much lower at $2,250, and with the gold plan, it's even lower at $0. So for those of you that have a lot of medical needs, you know you got to go to the doctor a lot, get a lot of services, go to the hospital, you go to the emergency room a lot, you need surgery. I would really steer you towards this gold plan over here. But as you look at this bronze plan again, the big area is the prescription drugs, hospital stay, surgery, and emergency room. Okay, these are the most expensive things that most of us have an interaction with our health plans throughout the year. So with prescription drugs, you would need to pay all of this $7,900, 100% out of your pocket. So if you needed brand name drugs or a hospital stay or surgery or an emergency room visit, under the bronze plan, be aware that you will be asked to pay 100% of the cost up to $7,900, at which point you've reached your out-of-pocket maximum. Out-of-pocket maximum is the number in which you don't pay anything else no matter what. for all covered services from in-network doctors. Once you spent $7,900 at the hospital stay, then you pay zero after that deductible. So if you have a $1 million claim, you would pay $7,900 of that, and the insurance company would pay the other $7,900. You notice how that changes a little bit with our silver plan. Much lower deductible, but a little bit higher out-of-pocket maximum. Now with this plan, if I have a hospital stay, an emergency room visit, or a surgery, I will pay 100% of the cost up to $2,250, and then I pay 30% of the cost. Aetna pays 70% of the cost until every dollar I've spent, including doctor visits, prescription drugs, urgent care, physical therapy, whatever it may be, all of the dollars I've spent in total cumulatively in the calendar year equals $8,200, then I pay 0%, and the insurance company pays everything else. So this out-of-pocket max number is important because this is truly most of what you're paying for in the insurance premium, which is the deal you're making with them that says, once I spend a certain amount of money, then you pay everything else and I pay nothing. Up to that maximum out of pocket, there is cost sharing, co-pays, or you pay some and I pay some, just like this 30%. You pay 30%, they pay 70% after your deductible. Now notice the way that this gold plan changes drastically from the other two. First of all, no deductible, a much lower out-of-pocket maximum. The co-pays are much lower across the board. No deductible for brand name drugs. And then the hospital stay, emergency room, and surgery all have a flat dollar copay. This means if I go to the hospital and I'm there for a week, and on the silver plan, it's $1 million, I'd pay probably all that $8,200. But on the gold plan, I pay no more than $500 per day in the hospital for no more than 4 days. So if I'm there 7 days, I pay $500 on day 1, 2, 3, 4, and day 5 and beyond of that same stay, I no longer pay a copay. Okay, so if you're having a baby, if you need surgery, if your kids are in the emergency room a lot of times, this gold plan is worth every penny because it's going to really reduce what it costs you to use your health plan. So those are our HMO plans. All of them are centered around the Sharp healthcare network. So most of you are already seeing Sharp doctors because you're with the Aetna Value Network. That's what AVN stands for, is Aetna Value Network. So with an HMO plan, you need to choose a primary care provider. If you don't choose one will be chosen for you. You can change this provider whenever you want, so don't fret about that. So let's talk about our PPO plans. So we've got a bronze and a silver PPO plan. They follow a lot of the same patterns as we saw before. The bronze plan is going to have a very high deductible. You've got some good copays here for doctor visits, for diagnostic lab work. You've got a $7 copay. For rehabilitation, you've got a $125 copay. Chiro is $125, which is a very expensive chiropractic visit. You could probably do better paying cash. Urgent care, $100 deductible waived. But notice how all the rest of the deductibles, all the rest of the costs are after the deductible, after deductible. Okay. Same with your prescription drug plan. Generic drugs in tier 1 are a $15 copay day 1, but brand name drugs are going to be after you pay a $7,350 deductible. You see our silver plan has a lower deductible, a lower out-of-pocket max. You got a little bit more in terms of benefits that are covered before the deductible. The brand name drug coverage is much better. So PPO plans are really great because they give you a lot of choice. They will cost you more, but you will be able to see more providers. So those are our PPO plans. These are our HMO plans. All of them are good. All of them meet Obamacare's requirements. So if you're looking for something that just meets the requirements of Obamacare that says you have to have insurance, any one of these plans will do that. So let's talk about dental and vision. So our HMO dental plan is with Delta Dental. We've got a silver and a gold. HMO dental plans are really great because they don't cost a whole lot out of your paycheck. And then Delta Dental has a really nice HMO network, lots of providers in San Diego that are in the HMO network. So for those of you that need dental benefits, maybe you just want a couple of free cleanings a year, the HMO dental plan is a really great option. for you guys. So there's no annual maximum on this. So you never run out of benefits. And you will also, if you need orthodontia, you need to choose the HMO plan. The PPO dental plan does not include orthodontia. So here's our PPO dental benefits from MetLife. We have 3 different plans, the Gold, the Platinum, and the Platinum Plus. Notice at the bottom there in red, calendar year max. With this HMO dental plan, there was no annual maximum. Really nice. With PPO dental plans, there's always an annual maximum. Now, annual maximum with dental works exactly the opposite of it, the way it did for medical. Remember, with medical, we said once you hit that maximum, you pay nothing else and they pay everything else. Well, with dental plans, it's the opposite. Once they've spent, let's say we're on this platinum plan right here, once the insurance company has spent $2,250 in benefits on you in a calendar year, they pay nothing else and you pay everything else. Okay, so that's important to note about PPO dental plans is there is a maximum benefit. Now, the maximum starts fresh on January 1st of every year. So for those of you that have a lot of dental work to do, and maybe you're not enrolled in any of the dental plans right now, you could join this MetLife dental plan effective June 1st of 2022, and you could have on this platinum plan here $2,250 to spend between June 1st and December 31st. And then on January 1st of 2023, you'll get a new $2,250 that you can spend throughout 2023. Now, maybe you just get all your work done, you use it all up, and by June 1st of 2023, you don't need it anymore and you can cancel it. So that's a way to pay for 12 months of dental PPO coverage, but really only have, but have 2 times that much as far as an annual max. So you're going to pay for 12 months of coverage, but you'd actually have $4,500 because you'd get $2,250 on June 1st and another $2,250 on January 1st. So those are our 3 plans. The Platinum Plus plan is very different in the way it covers non-contracted dental providers. So if you're seeing a specialized dentist, someone that doesn't take any insurance, the Platinum Plus plan would consider that provider an out-of-network dentist, just like the other ones. But the out-of-network benefits for the Platinum Plus plan are much better, meaning your reimbursement levels will be much higher. There will be less out of your pocket to see out-of-network providers. And of course, there's a higher calendar year max at $2,500. We got 2 vision plans, the Gold and the Platinum. These 2 plans are identical in every single way except one. So let's talk about what they're identical in. They have the same exact network of providers. So same vision providers in the Gold and the Platinum. Both of them give you a $10 copay for an eye exam once every 12 months. That's what these numbers are down here, is the frequency in which you're getting these benefits. So this first 12, this is how often you get your $10 copay for an eye exam. The second 12 is how frequently you get your lenses copay. So here's our lens copay of $25 with both the Platinum and the Gold plan. So it's so far exactly the same doctors, same eye exam benefit, same frames benefit. Now where they become different is when it gets to your frames allowance. So with the Gold plan and the Platinum plan, you both get a $180 allowance for frames, or or a $150 allowance for contact lenses. With the Gold plan, you get it once every 2 years or 24 months. With the Platinum plan, you get it once every 12 months. So for any of you that are considering purchasing the Vision plan, I highly encourage you to buy the Platinum plan because you get that frames or contact lens benefit once every 12 months versus once every 24 months. And the Platinum plan for an employee only is going to cost you just under $24 more per year for the better benefits. So what this means is you would pay $24 more in a year, and you would get $180 more in benefits. So the Platinum plan is a better value. There's nothing wrong with the Gold plan. I just find the Platinum plan to be a much better value. So let's talk about our enrolling and managing our benefit elections. We're doing this through a portal called Ease. This is the same portal you guys logged into last year, so many of you should be familiar. The URL is carltonoaks.ease.com. So let's go, let's get out of this presentation here and I want to show you the email you're all going to get. So this is exactly what the email is going to look like that you're going to get. You've been added to the portal. You got until May 27th. We have 5 plans. Here's Andy's email address should you need them. Here's my email address should you need them. You would click that login button and you'd be taken to the homepage. It looks just like this. For those of you who have never logged in, you'll need to put you'll need to choose a password. But for those of you that have been enrolled before or have gone through the system before, you'll just need to enter your username and password. Username is always your email address. Could be your personal email address, just matters what we've got on file. Wherever you receive the email is where you're going to need to, that's the email address you need to put in here. If you've forgotten your password, you can just click this forgot button right here and reset it. If you're on a mobile device, you can log in with your mobile phone, and then here's some different languages at the bottom that can translate some of the website. It doesn't translate anything that we've custom built into it. So let's log in. Now, since I enrolled last year, you're going to see my current medical, dental, and vision selections here. This is all effective 6/1 of 21. Up here in the top right, I've got my Start Enrollment button. I want to go ahead and hit Start Enrollment. It's going to give you an idea what to expect. It's going to give you a little overview. This video I'm recording is going to be embedded right here, so you can review it again later if you need. And hit Continue here. You're going to enter in all of your information. Notice these little asterisks here. These are the things that are mandatory. So you'll enter all your information here. Continue. Then you're going to want to enter your dependents. Now, please enter any of your spouse, your domestic partner, your children, stepchildren, adopted children into this section here, because it will allow you to see how much it would cost later on in the system to enroll them. By putting your dependents here does not mean you're enrolling them in anything at all. You're just putting them in the system. Okay, so enter them all in the system here. It's very easy to do. You hit the add button and you write all their information in here. Okay. If you don't have a social, you can just put kind of a dummy social like this in there. I'm going to just go ahead and close this out since I've already got my spouse and my child in there. So continue. It's going to ask if you're enrolled in Medicare. If you are, add it here. If you're not, go ahead and continue. Now you get to your benefits. So it's going to reflect your current enrollment. So we've pushed through whatever you're currently enrolled in. We are showing you this year's version of that. So for me, last year I decided I'm going to enroll myself. I'm going to waive my wife because she's got coverage through her employer, but I'm enrolling my child. Notice on the right here, your numbers will change instantly. Watch if I enroll her. Instantly the numbers change. So this is what I said. If you have dependents, make sure you put them in here, because you can very quickly tell on a semi-monthly basis how much my cost is going to be. So I know right off the bat that it's $227 per paycheck without my wife. It's $447 with my wife. So that means $220 a paycheck or $440 a month is what this person's going to cost me. And I can use that to compare to my spouse's benefit plan. Maybe this is a better offer. Maybe their offer is a better offer. So this will help you understand what that would be right away. So here we see a breakdown of all the plans and costs. You can hit this compare plans, and you can see all these plans next to one another. Okay, down here all the way at the bottom to scroll across. You can export that to Excel if you wanted to. Here it's showing me my current plan, so there's nothing to select here, as you can tell, nothing to select. This is just telling me right now for medical I'm paying $231.97 per paycheck. And then here's all the other plans that I have available to me. There's the POS is really your PPO plan, okay? They just call it something a little different. Here's a silver plan, and here's my plan, so $227. So my rates are actually going down $4 per paycheck, which is great. Underneath all these plans, you can see I've loaded in a lot of different documents for you to review. So if you want to understand how to access a nurse 24 hours a day, we've got a program for that. If you want to see the benefit summary for this plan, you can see all the benefit details for these plans. You can look very detailed into all the plans. We've got here, if you want to click to find an Aetna Value Network provider, you can click right here. It'll take you straight to the website. Okay. I would always just kind of continue as a guest, unless you can log in, unless you already have a login and everything. Go ahead and continue as a guest. And then here I put a little flyer that can kind of walk you through how to find an Aetna Value Network provider. So it gives you some step-by-step instructions Pretty good stuff there. Summary of benefits and coverages. This is a mandatory document that you must open. So you have to open it up. Obamacare says we must show you this. So it's a required document for you to open. Once you open it, that's all you can download it, you can print it, you can do whatever you want with it. And then here's a little flyer for the website and mobile application. So some good solid pieces of information just embedded into the portal. So, and you'll notice you'll see a lot of the same information with different ones. I can auto assign a provider. If I check this box right here, it's going to tell Aetna that they can choose a primary care provider for me, or I can search one by clicking this click here, find, and then of course there's this flyer you can follow along. So we'll keep all this the same. We'll get into dental. I'm enrolling my whole family on dental. It was $28.13 a pay period. It's going down to $27. That's great. Also, there's the different plans, other links that can be helpful. Continue. We get into our vision plan. I've decided just me on vision. My wife and kid don't need it. It was $537. It's still $537. Again, more links here for you. Continue. Now I get a summary that'll break down everything that I have. You can print your summary here. So if you wanted to print this and keep it, take it home, show your spouse, keep it for your files, go for it. Otherwise, you're going to want to go down and hit continue. You're going to want to sign forms. Now, when you sign forms, this is just like DocuSign. So for any of you that have used DocuSign in the past, you're going to type your name one time, and you're going to sign your name one time, okay? You're going to use your mouse, or you're going to use your finger if you're using a mobile device. And then once you click that, it's going to just take you through all the different areas that they need a signature. You'll click in the big green box. You'll sign all these places. Once you're done, you can certainly review it. You can see how all of it is tracking on the actual application. You're welcome to right click. You can save it. You can print it, whatever you want. You hit finish signing. You can submit any feedback if you'd like, or if you're all done, no problem, just hit this finish button right here. And once you get back to this page, you're going to be all done with your enrollment. So that is the way that we would go about enrolling. So what do you do now? You're going to be checking your email for your ease invitation login. You have until Friday, May 27th to complete this. Please do that as soon as possible. If you have any questions, or if you need any answers, we'd be happy to help. It's a pleasure being your broker. Thank you for paying attention through this whole presentation, and please reach out to us if we can be any help at all to you. Thank you and have a great day.